Hi, Doctor. You want to talk, congratulations, by the way, on the Cancer Center. What a beautiful facility. And it's a great addition to Silver Cross. I mean, Silver Crosses I've gotten, I mean, even if you're not in here, there's a lot of oohs and ahs as you drive by because it's such a beautiful building.
It is.
But I think most people try to stay out of the building if they can. You know, if you have to work here, that's one thing, but you don't want to visit too often if you can avoid it. Can you talk a little bit about the Cancer Center as far as, what are the medical benefits to the new equipment that's installed here? I mean, obviously, it's probably a lot of state-of-the-art stuff being brand new.
It really is. This is exactly the same equipment as we have down at the University of Chicago. Radiation is given with external beams. It's called a linear accelerator. And we have a state-of-the-art true beam. And what true beam allows us to do is to do very sophisticated planning, really focus the treatment on a very small area, just what we want to treat, spare normal tissues. What's also nice is from a therapist perspective, the therapists that are running the machine, it's very simplified so that there's very little chance for error. Everything is outlined in a very concise way. The treatments are quicker so that patients don't have to be treated for as long of a period of time. That helps with two ways. One, it's kind of uncomfortable if you're there. The quicker the better. Two, as a radiation oncologist, I don't worry so much about motion, tumors moving inside people. So the TrueBeam is really a remarkable advancement for radiation oncology. I tell patients when I started over 20 years ago, I was riding a bike, now it's a Harley.
Do you feel that the design is very impressive, by the way. We do have some photos that will show the audience, but do you feel like that design gives patients sort of a confidence, if you will, that I'm with the right staff, I'm with the right doctor, and we have the best equipment, and does that confidence help in the healing process?
I think that any time a patient has a positive experience and they're comfortable and confident, it helps them, and it may help with their recovery. It certainly helps them to tolerate the treatment better. Plus, that confidence impacts everybody around them. One of the great things about the Cancer Center is you can get all of the technology and the expertise of the University of Chicago, but you can get it right here. So your families can be involved. They can be there when the doctor needs to tell you something. They can help you come back and forth for treatments. They can really be involved in the process. And I think that's a huge part of a patient's comfort and healing.
Speak a little bit to, the fact that more and more people are surviving cancer now. Yes. Maybe a lot of research is, obviously the research is starting to pay off, but CNN put out a report earlier this week that said that upwards of 18 million additional people will survive cancer. And are we ready for it as a society? But is that a victory for doctors in the medical world to be able to attack cancer the way that they've done so successfully?
I think it's several victories. One, people are taking better care of themselves. They're not smoking. They're eating healthy. They're following the American Cancer Society guidelines. Second, I do believe that we're detecting cancer earlier with mammograms and colonoscopies and CT scans for smokers. I think third, we are impacting patients in that we're curing more patients, but we're also reducing the long-term side effects. So you can be a survivor and have some side effects of treatment or no side effects of treatment. So to be a survivor is kind of I love that aspect of survivorship. We're all survivors in so many ways. And we're going to see more and more patients surviving cancer, which is a wonderful thing.